What is an infection?
Could you say it's pathogen?
Yeah. A pathogen came in, something bad came into your body, and what's its job? To ruin you. So we must ruin it first. So when someone says infection, it doesn't necessarily mean bacterial. Could be bacteria, virus, fungal, parasite, protozoa, or helminths. What's a helminth? Yeah, worms. Nasty. All right. So that could be all kinds of infection. All right. Portal of entry means how did it get in? How do these nasty pathogens get into your body? Okay, I hate the word penetration. I don't even want to say it. Y'all don't make me say that. But that basically means is like, oh, it saw your skin and it, bam, went right through your skin. Okay, so that literally could be freaking anything, right? Give me some examples.
Go fishing, you stab yourself.
You stab yourself with a little hook or something. Okay, that's good. What else? I mean, it could be something smaller too. Like, let's say you got a mosquito bite and you scratched it, and then, you know, you touched it later, and we all have staph on our hands. That's normal. But it penetrated that skin barrier. Something as easy as that. Okay? And that would be contact precautions, right? Because it's something that's on someone's skin, and if it touched your skin after I got it, then she would get it by contact. Okay? Do you understand what I mean by contact, droplet, and airborne? You know those precautions? I have a video on YouTube that is very good if y'all don't know those. That will help you in adult one. Infection. No, I don't know. Infection precautions. It's called infection precautions. I give you acronyms and everything if you don't know. All right, next is direct. So direct portal of entry is you're something, touch their something. Oh. Like STDs. Okay. Yes, you bumped the ugliest with somebody else and that touched that, and there you have it. Bam, you got the clap. All right, next one is ingestion. So that is where you were taking it. And that could be from infected water, from infected meat. The most common, though, is fecal oral. So we see this in daycares and we see it in restaurants, right? So somebody has something nasty inside their body. It comes out through their poop. They wipe. They go to the bathroom, right? And then they go out and they don't wash their hands. And then here's your McDonald's hamburger with my hepatitis A in it.
Is that like airborne as well?
No, that's just ingestion, right? So then they're eating what came out of my poop. That's fecal oral. Okay. Next is inhalation. That one's easy. You breathe it in. Yeah. It could be either droplet or it could be airborne. So things can come through droplets. Like if I, and then it just, and then it kind of goes over to you. Or it could be that just I'm talking and through the air, it's going to travel. Okay. So droplet would be like flu, whooping cough, like, you know, things that get transmitted that way. Airborne is almost always rashes. I know it seems totally opposite of what it's on my video. Watch the video. Trust me. But the only exception to the rule for airborne is TB. TB is the only respiratory disease that's airborne. Everything else that's airborne is rashes. So like measles, varicella, which is chickenpox, those are all airborne. Okay. All right. So that's how it can get in. Those are 4 different ways that it can get into your body. You with? Okay, then there's 2 different types of how you get an infection. There is direct infection and there's indirect infection. So direct is called horizontal. What is horizontal? Yeah, girl. So when you lay down and you have sexual intercourse, that's how you get an infection. Okay, it's like this. Okay, then there's vertical, which is mommy's pregnant and mom passed it on to baby. That's vertical. Okay. That would be things like HIV, hepatitis, stuff like that gets passed on from mom to baby during the birthing process. Okay. There are 5 different stages of infection. Everybody's experienced these. Okay. The first one is called the incubation period. What happens in an incubation period? And it starts to grow. Okay. So I'm trying to think of an example that's not totally heinous because I don't want to gross y'all out on the first year. No, I don't mean it like that. I mean like it's just dirty, you know. Okay, so let's say that you no, I can't do that to y'all. I can't do that. Let's say that somebody in here is sick and they just didn't want to tell me because they want to come to session. Okay, and so they're just secretly like okay, and because she's sitting next to you, sorry it was you, because she's sitting next to you, okay, and you kind of got her junk. Now that bacteria went into your body, but are you going to immediately have symptoms? No. Okay, so it's going to start growing in your body. 1 of 2 things can happen during that time. You either have a great immune system. I know it's my kid. Just is it an emergency? Oh, then no. Okay, we'll go get you some water and I'll be there in a minute. So once it gets into your body, 1 of 2 things can happen. She said I'm sweating as an emergency. I can't. Okay. Because these days are so weak. All right. You can either have a very good immune system and your body can kill it off and you never even knew that you got exposed to it. Okay. Or your immune system was down for whatever reason. You stayed up really late studying, or, you know, you guys are in nursing school, right? And it starts growing in your body. So the incubation period is when, who are you? Oh, she's a photographer. Incubation period is from when you were exposed, so when she started coughing on you, okay, to before you actually produce symptoms. So the bacteria hasn't grown enough to where you're actually symptomatic. So at this point, you have no symptoms. You'll see little boxes. I'm kind of telling you what's going on. Okay. Then you're going to go into the prodromal phase. Y'all will hear this a million times in nursing school. What does prodromal mean? I feel like I'm getting sick. Have you ever felt like that? You have no symptoms whatsoever. Okay. You're just like, oh no.
Like mental.
I feel like I'm getting sick. Yeah, like you know how your body can like feel it coming on? That's called prodromal. And you may have just non-specific symptoms like fatigue or malaise. You just don't feel right. You feel like you're coming down with something, but you just have these vague symptoms, right? Then you're going to go to third stage, which is acute. Now you are coughing and sneezing and your body aches and you got fever. Those are horrible specific symptoms. You with? Then you go into the convalescent phase, okay? You know how like you've been real sick and then you're getting better and you're like, yeah, I feel better, but I'm just not 100% myself. That's what this is, okay? Convalescent phase is like, again, vague symptoms. I am getting better, but I still just feel kind of crummy, okay? And then you go into the resolution phase where I'm free and you have no symptoms. We got it? So don't look at your papers. Incubation, what happens? It's a growing in you. Yes, it's inside and growing. 2, prodromal. I don't feel good. Okay, 3, acute. It was bad. 4, convalescent. I'm not 100%. I still feel kind of bad, but I got kind of vague symptoms. Number 5, resolution. Very good. Good.